Hello, parents and students. We are here to help educate you with the Parent Education Series, and today we are going to talk about allergies and asthma. For those of you who don't know me, my name is Pam Boone, and I've been the nurse in the main building for quite some time, and I serve children K through 12.
Hi, my name is Sagan. I'm the new nurse in ECC. I took over for Gail. A lot of you will be seeing my face with the early intervention, playgroup, and preschoolers. Looking forward to meeting you all. And with that, we'll give you some information about what Pam mentioned, the allergies, asthma, and just, some information that is very relevant right now.
So some points of discussion, and we thought this was a really good topic to start with. Our allergies and asthma. As you know, it is allergy season, and many of you, as well as our students, have seasonal allergies and also have asthma. So we want to kind of go over our points of discussion. We're going to talk about allergies, some of the common ones that you'll see, some of the symptoms of allergies, how do you treat allergies. We'll also talk about asthma, which is related to allergies, some of the asthma triggers and the symptoms of asthma, some asthma action plans, and also how to manage asthma as best as possible. And also asthma and allergies, how to breathe better, and to help stop the spread of COVID-19.
So some of you might know what allergies are, but you're asking, well, what are allergies? If you look it up specifically online, allergies are something that causes your immune system to react to a foreign substance. Like pollen, bees, pet dander, the hair, or simple food that causes a reaction to people. Some of the allergies might be like peanuts or shellfish, but that's what a baseline allergy is.
So here are some of the allergies, like Sagan mentioned a few of them. Right now we're seeing a lot of ragweed and pollen and mold and just other plants that are dying off and have the seeds that are blowing around. Some of the ones you might find in your home are dust or dust mites, animal dander. It doesn't just have to be cats. It could be dogs. It could be, just your trigger to any kind of animal that is shedding. Some food allergies, some peanuts, some dairy, or shellfish are some of the common ones. And also maybe you might be allergic to medications.
So some symptoms that you'll notice when you have allergies, those annoying triggers. You have nasal congestion. Runny nose, it could be like that thin, watery after you sneeze, which sneezing is also a symptom of it. Postnasal drip, that's pretty much where your nose and your runny nose is going down to your throat. Coughing, watery and itchy eyes, redness or swelling of the eyes, some weakness or fatigue because, that nasal issue that you're having that really wipes out your body and makes you tired. You might even get hives or redness on your skin.
So how do you treat allergies? Well, first you can treat them with some medications. There's some antihistamines that you can get over the counter or from your physician. There are nasal sprays and nasal saline. What you want to do is monitor your own symptoms to avoid those triggers that are going to make you have all those symptoms, the sneezing and the itchy eyes. So, seasonal changes, we see spring allergies, we see summer allergies, we see early fall allergies. It really depends. You could have a spring allergy and have no fall allergies, or you could have the whole gamut of everything. So just knowing those triggers of what is specific to your allergy can help you monitor them. Weather, sometimes after a thunderstorm or windy days when you're getting a lot of trees and pollen blowing around, it could make your symptoms absolutely worse. And in these COVID days, wearing a mask does really help prevent you from inhaling a lot of those pollens and allergies that are outside.
So, how do you treat allergies? Here are some more tips on that. You know, if you realize that you're allergic to something, monitor the pollen counts and the mold counts. A lot of times you can go on like weather websites or just allergy websites, and they'll tell you if it's a high pollen day, if it's a high mold count. Honestly, I feel like the years keep increasing with that. Keep your windows and doors shut. You know, it might be beautiful out, but during these high allergy times, you're just going to have dust and, you know, the pollen coming into your house, which is going to trigger the allergies. So keep your windows closed. I mean, you can open your door if you have a screen that's shut, but just keep them closed for the time being. Of course, general hygiene. You know, hand washing, hand washing, hand washing. But if you're outdoors, you're going to have pollen blown in your hair, on your clothes. So you might want to shower, take a bath, or bathe afterwards. That way it will get all the excess pollen off of your skin, so you're not having it on your hands, rubbing your eyes, and getting triggered from that. And for some more severe cases, you can get allergy shots. So it's pretty much just a little series to see how are you responding based on medication, or what are you allergic to.
So we're going to turn now to asthma. What is asthma? The definition is it's a chronic disease that causes your airways to become inflamed, making it harder to breathe. So inflammation causes narrowness. All your bronchioles kind of tighten up, and it's really, really hard to breathe.
So what are some asthma triggers? Of course, there's smoke. Let it be cigarette smoke, secondhand smoke, or simple burning like bonfires, leaves, or even cooking and burning whatever you're making for dinner. The smoke causes your airway to get triggered. It flares it up, makes it kind of spasm. So that causes a trigger. Animal and pet dander. You know, a lot of people are allergic to cats and dogs, but that also induces the asthma because it's an irritant that pretty much bothers your breathing, airway, the bronchioles, everything associated. There's exercise-induced asthma. Some people can't handle that constant workout. Well, it's not that they can't handle it. They struggle because their lungs can just not, get enough oxygen while they're needing it. So they start to hyperventilate a little bit and struggle. Also emotions, anxiety, and this has been the year for anxiety. Emotions can trigger it. If you're getting really sad, angry, upset, you're getting very, just filled with the emotion. So instead of trying to breathe in, you're just struggling with it. There's also molds and yeasts that also triggers asthma. And the cold air and high humidity, with those sudden drops in temperatures, your lungs might not be able to compensate, or when it's really humid. I know for myself, in general, it's just hard to breathe. So that can trigger an asthma flare-up as well.
So some more triggers. If you are sick, ill, especially with some lung issues, that could absolutely make your asthma worse. Pollen outside, any kind of strong odors or fumes, your airways react to those and start closing up, so you're having more trouble breathing. Some asthmatics, their triggers are foods or any kind of like added preservatives, red dye, things like that. Some are triggered by aerosol sprays, just, spraying Lysol around the room and then you inhaling that could be a trigger for, your specific asthma. And then, always cockroaches and bugs, they absolutely have an effect on your airways.
So some common asthma symptoms. It's similar to allergies, but it's different because asthma is more of the chronic issue. You have coughing, wheezing, that's where you're just not getting that breath and you hear like that high-pitched type sound between each breath. Shortness of breath, you just can't catch up with breathing. Or you're breathing so fast that your body can't compensate and then your chest gets tight. So those are some symptoms.
So here are some serious symptoms of asthma. We talked a little bit about having it hard to breathe, but when you see your ribs contract, I mean, you're really, really working hard to get that air into your lungs. And your chest is expanding, but it's not really coming in to to get a nice deep breath and to get your oxygen saturation where it should be, where you're, you know, you're pink. So, if you're not pink, some of the other symptoms you could see, your lips getting dusky or blue, or your color change might be, not necessarily pink, but it comes to a more of a pale, like a dusky skin color. And obviously the last one is gasping. You're really, really working. You're getting excited. You can't breathe. You're nervous. And your nose actually flares out, your nostrils, and your body is doing whatever it can to get as much air into your lungs as possible.
Now, there are some things called an asthma action plan. A lot of these are used in school settings, which, your physician or primary care provider will provide to the child, and sometimes adults even have them. But the main purpose of an asthma action plan is for a developmental standard for nursing practices. It helps the school and nurses determine how severe is the asthma, what are the triggers, what do we do to treat if there is a trigger. So the asthma action plan identifies the severity. Is it a major trigger that they have? Is their reaction just minor? They might need an inhaler every now and then. Or do we have to maybe give them some kind of, not anaphylaxis, but some prophylactic treatment to help them before working out, before gym? So the asthma action plan has 3 different zones. The green, which means, you're good to go. You might have a little trigger, but it's not bad. The yellow, okay, maybe you have a standby med in the nursing office. You need it before. And then the red zone, it's, okay, I'm at the extreme. I need to take my inhaler before, after. I might need a neb treatment. If you can't breathe, maybe EMS might need to be contacted because your asthma is so severe. And then there's the treatments and restrictions, the medications, what you can and cannot do, the emergency plan. Do we call 911? Do we administer epi? If there's like some type of flare-up even, do we contact mom and dad or another guardian? And then there's also the medication. So what medication did the prescriber indicate? What is the indication? Why are we giving the medication? Is it for asthma? Is it for breathing? Or is it simple respiratory treatments? What's the dosage of the medication and the administration route? So is it an inhaler or a nebulizer?
And so this is what a typical asthma action plan will look like. And, your doctor, as well as you, certainly can fill it out and send that to school. We do have extras here at school if you need one. And like Sagan said, it just kind of gives you a green, yellow, red of what your triggers are and what we're going to do to treat your individual child. One thing I do want to, stress is that we do have a lot of inhalers here. We have a lot of, nebulizers, albuterol for our machines. However, many of them have been expired since we haven't been here since March. So please, when the students do come back to school and your child does have asthma, please make sure that you send in a current inhaler, and as well as a few albuterol vials, so that we have them here with your child's name on them if your child should have an asthma attack.
So managing asthma. So what you can do to help to treat the asthma triggers, symptoms, etc. Go to the physician or PCP, and the asthma action plan is a big deal with everything because, again, as we said, it identifies what is the trigger, what are the triggers, what are the safe zones, like the green zone. The yellow, we have to be a little cautious, and the red, well, we really need to be on top of these symptoms and these triggers. What medications are being given. So when we go to the medication administration, as Pam was mentioning, we have inhalers. There's albuterol, there's Ventolin, miscellaneous things. Mm-hmm. There's nebulizer treatments where it's like more of like an aerosolized, you put the albuterol in the machine, you get a mist of it, it helps kids breathe a lot of times. And then you have long-term control medicines. Those are things that you might take at home on a more daily basis. And then you have the quick relief where the child might just run in for a little puff of the inhaler and go back outside and play. But those are the typical ways to manage asthma.
Mm-hmm. And just to add to that, the long-term control medicines, that's something that you have to take, once a day or twice a day as prescribed by your doctor. Even though your child may say, oh, they're not coughing, they're not wheezing, they're having a good day. That's something that over time is just going to be in your body so that you're able to fight off any of those triggers, and not have an asthma attack.
So some more information about how to manage asthma. Limit overexertion. We all love to go for walks at times. Kids love to play, but sometimes you have to explain to the child, you can't run for too long, and you have to let them know if they ask, maybe their lungs just, they need a little break. Like we all need a little break. So don't overexert. Don't run too much. Don't play too much. Don't try to overdo it with picking stuff up, pushing stuff. Know your exercise restrictions or limits. Some of us, we just have those days where we want to just keep going. But if you know that you can only do 30 minutes at a time, set your limit at 30 minutes, because you don't want to start to, hyperventilate or overexert your lungs or just breathe harder or struggle to breathe. And also, if you know your triggers, try to minimize or eliminate them. Keep those windows shut. Take your allergy medication. If you're allergic to cats and you love cats, figure out a way with your allergist, how can you have them? Avoid the foods that you can't have. Like peanut allergies are very big nowadays. Avoid peanuts. So minimize or eliminate those things that might cause a respiratory flare-up.
And some of what we see in the schools with physical education class is that the children are not really getting enough water or hydration. So if you're dehydrated, your triggers are going to move on quicker. So always just, make sure you have enough water, prior to any type of exercise, either during exercise as well as after exercise.
So with that, asthma and allergies, we want you to breathe better and stop the spread of COVID-19. So to do this, you want to avoid the large crowds. The bigger the group, the more susceptibility that you have to maybe catch somebody's respiratory droplets, or maybe somebody sneezes and nobody wants to be around to sneeze. Cover your mouth when you cough. Instead of using your hand, I call it the vampire cough. You cough in your arm. You sneeze in your arm. That way you're protecting others around. And honestly, worst case scenario, you can change your shirt, put a little hand sanitizer on it, depending on what kind it is. But cover your mouth. Don't touch your face constantly. If you're wearing a mask, you're just taking the germs that your mask received, and you're touching your face and putting them all over. Maintain social distance. If you're going to be with somebody for greater than 15 minutes, you want to ensure that you're at least 6 feet apart. Or if you're next to somebody, try speaking in the opposite direction or wearing the mask. And sanitize all common surfaces. So if you're at work for the day, or if your child's in a play area for a certain time, wipe down that surface at daily intervals. You're going to help to reduce the spread of germs. And I didn't put this there, but hand washing. Mm-hmm. We always say hand washing. 20 seconds, sing happy birthday, row, row, row your boat. Put your child's name into the song. Anything to get the hand washing. Soap and water does it best.
There's nothing like soap and water. No matter how many hand sanitizers are around. If you have access to soap and water, that is always, always the best. So here are some little tips to breathe better and to stop the spread of COVID-19 continuing. Stay home if you are sick. We don't want you here in school. We love you, but you need to stay home now more than ever. Wear your face mask. That's going to protect you. That's going to stop you from touching your own face and your nose and your mouth. Watch for those symptoms, for the fever, the cough, the loss of taste or smell. Don't stop using your asthma medications. They need to continue, both your preventative medication as well as your rescue medications. And again, you cannot wash your hands often enough.
So this is just a little chart. A lot of people, I know, we can all be like, with COVID going on this year, is it allergies? Is it COVID? cold versus COVID. So this is a graph, and you'll see this in both English and Spanish in this presentation. It pretty much takes the symptoms of both COVID and allergies, which you'll see in the center. You know, there's cough, shortness of breath, difficulty breathing, fatigue, headache, sore throat, congestion, and runny nose. But when you break it down further, COVID is more of the severe side versus allergies. So in COVID, you'll have fever and chills, typically a fever of 100.4 or higher. It's not relieved by Tylenol or any other fever-reducing agents. You'll have muscle aches and body aches. Everything just hurts. You'll have that new loss of taste or smell. Like, for instance, if you eat garlic or Chinese food or any type of like really pungent food, you just won't be able to taste or smell it, and you'll be like, I used to love this, what happened? You'll be nauseous, vomiting, and diarrhea. You won't have all these symptoms with COVID, but they're more severe with COVID. When you look more at the seasonal allergies, you'll see more of the itchy and watery eyes, you know, red, you just want to rub them because they're so irritated, or sneezing. And then you go back to the center, and yes, COVID and allergies both have similar symptoms, but COVID is more extreme and more severe, and you have more symptoms. And then allergies, it's just that more annoying cold-like symptom.
And if you do suspect you have COVID, you know, please get tested and notify the school nurse.
And just stay home. You don't want to infect anybody that you care about. Not on purpose, but sometimes it happens because you just don't know.
So here's just a little sign. That's the sign for breathe.
And then the finger spell, we have B-R-E-A-T-H-E. Thank you.
Thank you very much. We hope you learned a little bit about allergies and asthma from this presentation, and we will have another one for you shortly. So be safe, and can't wait to see your students back at school.
Bye.
Take care.